question. Compared to the wave that we had back in January, this is very unique in that the case rise is pretty rapid. In our clinic itself, we're having a lot of positive cases within the past week to week and a half. And majority of them are in the younger population. I would say on average below the ages of 60. Most of the older adults are pretty much vaccinated, so we don't see much of those cases, but it's more in the younger cases. And the worrying thing is that the speed at which these cases are going up is quite concerning. So that is a big difference from how we saw things in January.
Yeah, as we were saying during the break, it seems like this one is definitely different than the previous outbreaks or waves. It seems like everything happens a lot quicker with this one. Not only just the transmission, but it seems like people that have caught this Delta variant coronavirus have gotten sicker faster than what they were.
Yep, absolutely. And there are rising cases in the hospital as well, both in the clinic and in the hospital. So, yeah.
Man, right when you think that there's somewhat of a light at the end of the tunnel, it gets a little bit further away, it seems.
Yeah, all the medical societies and CDC all recommend that vaccination is really the key to try to get over this battle. So if you are not vaccinated, we still recommend getting the vaccination. And if you still do have questions regarding whether you should get vaccinated or not, please speak with your doctors. Don't hesitate. We're here to answer all the questions. And in fact, in our clinic, we even offer the vaccines now. So it's that easy to get it if you are getting it. But it's an individual decision, but the recommendation is to still get it.
Absolutely. And as we kind of transition away from COVID talks, I feel like that's all we really do on here is talk about it. I mean, rightfully so, because it's super important. But let's talk about your, specialty area, and that's sleep disorders in older adults. Now, is that one of the main, I guess, illnesses that you see in older adults? Because I mean, I'm not an older adult, I guess you could say, but there is a pretty lengthy list of older adult health issues, and is that one of the main ones?
Yeah. So I'm a physician that cares for older adults, so it's called a geriatrician. And in our community specifically, you might very well know the average age is going up, and the percentage of older adults is rising. And we treat for various different older adult related specific syndromes. This can be swallowing disorders, it could be sleep disorders, could be depression. There's a huge host of diseases and syndromes that are seen more in older adults. So we specialize in that care at our clinic, and I'm trained in that. So the training itself, it's about a year, 1 to 2 year training that specializes specifically for the care of older adults.
So what are, I guess, some of the contributing factors to a sleep disorder? I guess there are many things, but what are some of the main ones that you see out there?
Yeah, so great question. So when we talk about sleep itself in older adults, first to define it, sleep is where one would not be satisfied with the quantity or the quality of their sleep, and specifically there is increased morning awakenings and not enough hours of sleep, more nighttime awakenings, and not being able to fall asleep. So all these fall under the category of what we would call insomnia, where it's difficulty with sleep. Now, when we talk about sleep, what are the contributing factors? Sleep itself can be caused by a disease process of the brain, it's in and of itself, or it can be contributed by secondary causes. So when we talk about that, we mean patients who have certain medical conditions like sleep apnea, and in simplest terms, that would be where people, you would know if someone near you snores, they're at risk of having sleep apnea, and that essentially means that you're not getting enough oxygen. That can impact sleep. Just like that, there's a variety of diseases that can cause that. Depression, for example, can contribute. And then that's one cause, and then another cause, as I mentioned, is the disease itself you can have without any other reasons. And then the third is medications. Certain medications can cause you to have impaired sleep. So multiple factors, but when you talk with a doctor, they can analyze it and figure out are these causes contributing or not.
And I feel like, because I guess I consistently deal with sleep issues. I would contribute that to the job because of the early mornings and things like that. Now, a lot of people, they wouldn't, go to the doctor. Like I've never thought to go to the doctor for any of these reasons. I would just maybe do the wrong thing, which is what I'm asking you. If this is the wrong thing, like taking, NyQuil or what is it? Not serotonin. That's to wake you up.
Melatonin.
Melatonin. Thank you. Melatonin, things like that. Now, those are, I mean, they'll put you to sleep, but you're still not getting, appropriate sleep, right?
Yeah, so the first part of your question regarding stress. So yeah, stress contributes, pain can contribute, waking up at night to pee often, that can all contribute. So those are precipitating factors for insomnia. And then the second part of your question regarding medications, yeah, medications is one option. But really the first line treatment is a non-medication approach. So there are behavioral therapists who are trained to help patients understand the misbeliefs regarding how they should sleep, why they should sleep, and they train, there's specific training that goes through with the therapist and the patient about how to tackle that without medications. It's actually pretty successful. It has it does improve the sleep efficiency. It's a whole different topic to talk about, but one particular example would be called sleep restriction, where the therapist trains the patient to reduce the number of hours of sleep, and then during those hours their sleep improves, and as their sleep improves the number of hours is gradually increased. And so there's a variety of different methodologies, but they're actually pretty effective. The only challenge is that in this community, and even in many communities, getting trained therapists in that is difficult. So we end up pursuing medications. Now when we look at medications, you mentioned a few examples. So melatonin is used. NyQuil is also used. These are very common, but NyQuil in particular is not the best option for older adults.
Well, okay, for older adults, that's not what I needed you to say.
Yeah, so for older adults specifically, it's not the best option because it does have a chemical called diphenhydramine, also known as Benadryl, which could cause confusion, increased bladder, urinary retention, so it has side effects. Speak to your doctor. There are like 5 or 6 different groups of medications that we prescribe if the sort of non-medication approach fails.
Yeah, we're speaking with Dr. T. It was cool to call you Dr. T.
Yeah, that's what they call me in the clinic.
I was going to say, I think I might have said your name correctly the first time. I don't want to, go too deep and try again and then butcher it somewhere down the line. Again, speaking with Dr. T from WVU Medicine, talking about sleep disorders in older adults. So there's a lot of technology out there now that you can, track your sleep. When I have a band on here that one of the main aspects of it is to track sleep. Now, those, I feel like they can get pretty, I guess, in the weeds with different, data that it's giving you and whatnot. But are they still, your Fitbits, your Apple Watches and stuff, are they good to wear to track, sleep and see what kind of sleep you are getting?
Yeah, so that's a great question. So there are technology devices that we do use to help track sleep. One being what you mentioned, which is in the technical term is called wrist actigraphy. It basically checks to see how long you're awake and how long you're asleep based on your body movement. A lot of times most devices are not accurate, but they can give a ballpark of how your sleep is, and so sharing that with your doctor is definitely helpful because it can help rule in and rule out certain sleep disorders. So when I talked about insomnia as a general term, but there's so many different types of sleep disorders. For example, there are things that affect you, like call restless leg syndrome, or periodic leg movement disorders, or sleep apnea. All these contribute to leading to insomnia. So these sort of tests, like the wrist actigraphy, or even something called polysomnography, also known as sleep study, where you go to the hospital and you have a sleep study. All these tests or technologies we do use to help diagnose sleep disorders.
Have you personally taken part in any of those sleep studies?
I did not, but it can be inconvenient to do it in the hospital, which is why now there's also a home sleep study. So if the doctor suspects that your sleep issues or your lack of being fresh in the morning is due to sleep apnea, for example, then you can do this test at home and we can test to find out whether you have it or not. So it's pretty convenient.
Yeah, I've seen videos and pictures of people, in the room with the bed, the big, medical room with the bed and everything wired up. And I always think there is no way I would be able to fall asleep with all that stuff on me and knowing all these people are looking at me.
Yeah, it is tough. It is tough. Some patients do convey those concerns, but it's what we have right now. Yeah.
Perfect. Again, talking with Dr. T from WVU Medicine East at the Berkeley Medical Center. Now, you spoke about sleep apnea. Now, I know a ton of people, it seems, with sleep apnea, and they have the masks and things that they'll wear. It all started because they were heavy snorers. Now, I have unfortunately been pegged as someone that is a heavy snorer. I've been told multiple times by different people, aggressively too, multiple times. But is that a main sign that you could have sleep apnea? Is that like a gateway to sleep apnea?
Yeah, that's a great clue.
Yeah.
So if you do snore at night, or if your loved ones or a caregiver notices that you're snoring, it's actually good to let the doctor know, because we do have specific screening questions that we go through. And if you're positive for that, then you are going to be referred for testing. Even if you're not positive and there's a strong suspicion of it, then we do test you, because the concern with sleep apnea is that not only does it impair your sleep, but it also affects the blood flow through your lungs and heart, and in the long term it can actually lead to devastating consequences. So treating it is important. There's actually a lot of patients do say that wearing the mask at night is very hard, and some people do really well, but those who have a difficult time wearing it, there's actually a new technology that just came out in the past few years called, one company that does it is called Inspire.
Mm-hmm.
It's basically an implantable device like a pacemaker that stimulates the neck muscles to help you improve your sleep by not snoring.
Wow.
Yeah.
Yeah, some of the people I know that have worn that wear the sleep apnea mask say that the first time they wore it, it took them a little, of course, time to get used to it, but once they got used to it, they had like the best sleep of their life. So maybe I'll have to get one of those one of these days. Again, speaking with Dr. T from WVU Medicine East, Berkeley Medical Center. Before we let you go, let's hear a little bit about yourself, your background. I saw you went to WVU and did some studying there. So can you let people kind of know about yourself a little bit?
Yes.
It's always a tough question to ask.
No, that's not a problem. So I'm originally from Canada.
Mm-hmm.
I was born and raised there. I studied at University of Waterloo from undergraduate. I did my medical school training at St. George's University, and then subsequently in the U.S. I did my internal medicine specialty training at Rutgers University in New Jersey, and thereafter I did my geriatric specialty training at the Mayo Clinic.
Oh, wow.
And now I've been here for over a year now, and at the geriatrics clinic at WVU Internal Medicine Associates.
Wow, so you've been all over the place. Now, are you Toronto side of Canada or Vancouver side of
I'm
Canada?
Toronto side of Canada.
So you a Raptors fan?
I'm a Raptors fan, yeah.
Oh my, I'm a Knicks fan, unfortunately. Although, hey, Kemba Walker on the team now makes me feel a lot better about things.
Yeah.
Again, speaking with Dr. T from WVU Medicine East, Berkeley Medical Center. Thanks for stopping in and chatting with us a little bit. I feel like sleep is one of those topics that doesn't get spoken about a lot, but it is, one of the critical, life things that we have to do every day. So if you're not getting great sleep, it affects everything down the line.
Yeah, no, it's a disease that it's very prevalent in older adults. It's over 30% prevalence, and please, if you are concerned about your sleep, please discuss it with your doctor.
Absolutely. Thanks for stopping in, and stick around for more here on Panhandle Live on WEPM and WCSD, the Panhandle News Network.
Thanks for having me.